Myself Dr. Mahmood, and today I will be talking about diarrhea in the context of peds. So basically what is diarrhea? If there is 3 episodes or more than 3 episodes of loose motion in 24 hours, or if there is 1 episode of loose motion but that must be watery in consistency, so that is basically diarrhea. How WHO classify diarrhea? So there are different types of diarrhea. That is acute diarrhea, chronic diarrhea, persistent diarrhea, and dysentery. So what is acute diarrhea? If the loose motion lasts less than 14 days or less than 2 weeks, so it is actually acute diarrhea. But if loose stools persist more than 14 days, so that is called as chronic diarrhea or persistent diarrhea. But now you will see what is the cause. If the cause is non-infectious, so it is chronic diarrhea. But if the cause is infectious, then it is persistent diarrhea. Now, if the loose stools containing blood, so that is called as dysentery. So there are two categories: infectious causes and non-infectious causes. So in the infectious causes, the most commonly it includes the viral, bacterial, and parasites. So in the viral, the most common cause is rotavirus. So rotavirus is more common in less than 5-year patients that develop diarrhea. Also, it is reported that the adenovirus can cause the diarrhea. Now, what are the bacterial causes? Bacterial causes are different. That might be E. coli, cholera, shigella, and salmonella. So these are different categories of bacteria which actually more commonly involve the diarrhea. But in the context of parasites, it includes the amoebiasis and giardiasis are the most common diseases associated with diarrhea. Now, what are the non-infectious causes? So, in the non-infectious causes, most common causes indigestion are food allergies. There are some child which are allergic to certain foods, like some child when they took the Chinese food like Manchurian, so after that they develop diarrhea. And also some child when they took the cow milk or buffalo milk, so after that they develop the diarrhea as it lead to lactose intolerance. Also it is reported that certain drugs it can cause diarrhea, that is ampicillin, amoxicillin, and laxatives. It can also lead to diarrhea. So what really happens in diarrhea? So in diarrhea, there is fluid and electrolyte loss in intestine. As a result of that, it leads to fluid and electrolyte imbalance. So as a result of this, there is decreased fluid in the intravascular compartment, so our body starts as a compensatory response and it decreases the urine output and increase the thirst mechanism of the body. Now, if there is more stools passes, so there will be more dehydration and the patient may manifest in the form of lethargy and drowsiness. Now, what are the signs and symptoms? There might be loose motion, vomiting, abdominal pain, and anorexia. There are certain important red flag symptoms which you need to recollect. How you can rule out the cause of diarrhea? If there is a rise watery stool, so it implies a cholera infection. If there is curdling milk-like stool, so most likely it is because of rotavirus infection. If there is green, yellow, watery loose stool along with the bad smell, so that is because of bacterial infection. If there is green, yellow loose stool along with some blood contained in it, so that is because of amoebic infection. There is a jelly-like stool, so that is because of intussusception. If there is greenish liquid loose stool, so that is because of post-URI infection. So actually diarrhea can lead to dehydration. As a result of this, we categorize the dehydration in the 3 compartments. There is plane A, plane B, and plane C. Now we divide this according to the management plan of the patient. Now in the plane A, patient have diarrhea but there is no signs of dehydration. The baby will be active and alert, the eyes will be normal, the eyes will be moist, the tear production is normal. If you see the skin turgor, so the skin pinch will be normal, the patient drinks normally and the urine output is normal. So, and it means there are no signs of dehydration and the patient fall in category A, that is plan A. Now, if I say plan B, so in the plan B, the patient develop moderate dehydration. This is also called as, it is also called as some dehydration. Now, in some dehydration, if you see the general look of the patient, so in the general look, the patient will be irritable, restless, and if you see the eyes of the patient, there will be sunken eyes, the eyes will be dry, the tear production is decreased, and if you see, if you pinch the skin pinch goes back slowly, and the patient vigorously drink. He drinks more and more, and if you see the urine output, so the urine output also reduces. Now in the plan C, the patient develops severe dehydration. Here the patient is lethargic, drowsy, sleepy, and if you see the eyes of the patient, there will be very sunken eyes. The tear production is almost absent. The eyes are very dry. The skin pinch goes back very slowly, that is more than 2 seconds. And if you see the urine output of the patient, the urine output is almost absent. What is the management? Depending upon the plans, we have different management. Like if a patient fall in category A, in plan A, so in this condition you have to give the oral treatment to the patient. Also you can give ORS or ORT, some limupani, etc. So basically, what is ORT or ORT or the oral rehydration therapy? It is basically a specific solution containing salt, sugar and water. So you can give the oral rehydration therapy, you can give the ORT. ORS or ORT can give after each loose stools. If patient develop vomiting, then you can wait for 15 minutes and after 15 minutes you can resume the ORT. Now if there are signs, if there are certain signs like if there are persistent vomiting, if there is refusal to feed, if there is a decreased urine output, so it's important to the mother to come to the hospital again. Now the important is those babies which is on mother feed, they can recover very easily as compared to the babies which is on bottle. We have to admit the patient as there might be a chance that patient may fall to the plan C phase. So it's important that you have to admit the patient and then you monitor the patient. There are 3 categories: daily fluid requirements and fluid to correct this dehydration. Replace the ongoing loose stool with ORS. Means if 100 ml loose stool pass, then you have to do 100 ml fluids. Now in the daily fluid requirement, how you will give the fluids? So it's important that you should see the weight of the patient. If there is in the first 10 kg, you have to give the fluids in 100 ml per kg. And if the weight is 10 to 20 kg, then you have to give the fluids in 50 ml per kg. But if the weight is more than 20 kg, then you have to give the fluids in 20 ml per kg. Say if a patient is having weight 12 kg, so in the initial 10 kg you have to give how much fluids? That is 100 ml per kg, right? So 100 multiplied by 10, that is 1000, and if the weight is 12 kg, so the additional 2 kg, so that is 100. So you have to add both of this and you will get the 1100 ml fluids per 24 hours. And the second phase is you have to correct the dehydration status. So in this phase you have to give the fluids in 75 ml per kg over 4 hours. If there is vomiting, then you have to wait till 10 minutes and then you can resume. Now in plan C, you have to admit the patient and you have to give the fluids in 100 ml per kg. So further we divide this 100 ml per kg in 2 categories: 30 ml per kg and 70 ml per kg. If the patients are feeble after 30 ml per kg, then you can repeat the dose as well. Now, what are the nutrition status and the diarrhea? So, it is very important to educate the mother to continue the breastfeed, as it is being noted that the babies who are on breastfeed, the chance of recovery from the diarrhea is more as compared to the babies which is on bottle feed. It should not be restricted in diarrhea as it increases the water and sodium reabsorption. It also improves the epithelial lining of the system. It also prevents the malnutrition as well. So you can give khichdi, smashed bananas, potatoes, coconut water and sabudana. These are the things which you can easily give to the patient, to the babies if there is diarrhea. what you should avoid in diarrhea. You should not give the dairy products to the babies. It is very important to avoid the cow and buffalo milk in the babies till 2 years of the patient. Till 2 year age, you should not give the cow milk or buffalo milk to the babies because the babies are more prone to develop the diarrhea as it can lead to lactose intolerance. So you should not give the cow milk or buffalo milk. You should not give the over fermented food to the babies. Also, you should avoid the spicy and oily foods to the patient. Additionally, you should not give the cold carbonated drinks. Fruit juices and dry fruits must be avoided to the babies. So that's all about the diarrhea in the context of the peds. So I hope you like the video. Make sure to subscribe our channel and stay in touch. Thank you.